Secondhand smoke is a global health threat, causing numerous diseases and premature deaths in both adults and children. A 2019 study revealed that secondhand smoke was responsible for 7.4 deaths per 100,000 people worldwide due to heart disease and stroke alone. Exposure to secondhand smoke, even for brief periods, has immediate and long-term health consequences. In adults, it increases the risk of coronary heart disease, stroke, lung cancer, and other respiratory illnesses. Children exposed to secondhand smoke are more susceptible to respiratory infections, ear infections, asthma attacks, and even sudden infant death syndrome. The harmful effects of secondhand smoke are linked to the thousands of chemicals it contains, including nicotine and numerous carcinogens. These toxins can damage blood vessels, increase blood clotting, and impair heart function, leading to heart attacks and strokes. In children, secondhand smoke can irritate airways, trigger asthma attacks, and hinder lung development. The dangers of secondhand smoke extend beyond immediate exposure, lingering in the form of third-hand smoke. This refers to the residual nicotine and other chemicals left behind on surfaces after someone smokes. These particles cling to clothes, furniture, walls, and even dust, posing a hidden health hazard. Even after the visible smoke dissipates, these toxins can linger for months, reacting with other indoor pollutants to create harmful compounds. Infants and children are particularly vulnerable as they crawl, play on the floor, and frequently touch their mouths, increasing their risk of ingesting these harmful chemicals. Contrary to popular belief, metabolic rate remains stable throughout most of adult life, from age 20 to 60 years old. This groundbreaking research, published in the journal Science, challenges the common misconception that metabolism significantly declines in early adulthood, a belief often used to explain weight gain. Researchers analyzed data from over 6,400 individuals across 29 countries, using a precise method called doubly labeled water to track calorie expenditure. They found that metabolism peaks in infancy, gradually declines until age 20, then plateaus until age 60, after which it slowly declines again. This suggests that factors beyond metabolism, such as diet and lifestyle, play a more significant role in weight management during adulthood than previously thought. The research hints at a potential link between the decline in metabolism after age 60 and the increased incidence of age-related diseases. Though the new study challenges the idea of a universal metabolic slowdown with age, individual metabolic differences still exist. Some people naturally have a faster metabolism, meaning they burn more calories at rest than those with a slower metabolism. Factors like genetics, muscle mass, and hormone levels can all influence metabolic rate. However, fast metabolism doesn't grant immunity to weight gain if calorie intake consistently exceeds expenditure. A balanced diet and regular exercise remain crucial for maintaining a healthy weight, regardless of your metabolic speed.
Diabetes drug may slow Parkinson's disease, according to a new study. Researchers have found that lixisenatide, a drug used for type 2 diabetes treatment, may significantly reduce the progression of motor symptoms in Parkinson's patients. This discovery is particularly exciting as it builds upon previous research with exenatide, a similar diabetes drug. Scientists believe these drugs, known as glucagon-like peptide-1 receptor agonists, could work by improving insulin resistance within the brain. Lixisenatide is also used in some weight loss medications known as skinny jabs. In the study, participants with recently diagnosed Parkinson's were divided into two groups, one receiving lixisenatide alongside their regular medication, and the other receiving a placebo. After a year, the lixisenatide group showed remarkably little progression of their motor symptoms, compared to a slight worsening in the placebo group. This difference persisted even after the trial ended and Parkinson's medication was stopped, suggesting a potential protective effect on brain cells. While the drug can cause side effects like nausea and vomiting, researchers are hopeful about the potential benefits. Further studies are needed to fully understand if lixisenatide truly slows disease progression, to determine optimal dosages, to see if the benefits persist long-term, and to explore whether the drug could be useful for patients in various stages of Parkinson's disease.